The following instructional video will review the care, maintenance, and removal of suprapubic catheters. This is the bladder, and this is the urethra. Catheters are tubes that go into the bladder and drain urine. Often, a catheter goes through the urethra, as seen here. A suprapubic catheter goes from the bladder out the skin in the pubic area. They are often used for ease of patient use and to reduce discomfort that can be caused by urethral catheters, such as feeling a persistent need to urinate. Suprapubic catheters can allow the person to urinate normally through the urethra and drain the residual urine through the catheter. Suprapubic catheters are also useful if patients need prolonged bladder drainage, and because they also enable a patient to void on their own even while the catheter is in place. Supplies required for the suprapubic catheter maintenance are a voiding hat, which sits over the toilet brim to record urine output, a Foley catheter itself, and a catheter plug. If the bladder must be continuously decompressed, such as to allow healing due to a bladder injury, a leg bag can be used. Leg bags can be switched out at night for a larger drainage bag that holds more urine to avoid overfilling the leg bag. Suprapubic catheters use the same catheter as urethral catheters. They're just placed in a different location. They have a balloon at the end of the catheter that keeps it in place. It's very important to use the balloon port to fill the balloon, not the drain port. The balloon is inflated with 10 milliliters of fluid. The balloon acts to prevent the catheter from falling out of the bladder. We often use a catheter plug instead of a drainage bag. These are plastic devices that are pushed into the end of the catheter. Remove the plug from the package. Be sure to also remove the clear plastic cap. The catheter plug will not fit into the end of the catheter if the thickest portion is attempted to be inserted. The clear plastic cover should also not be used as a catheter plug, or be used while the catheter plug is in place. The clear cap can be used to store the catheter plug when it is not in use. The tapered end of the plug is inserted into the end of the catheter. This is the correct placement of the plug. The catheter plug should be inserted firmly into the end of the catheter so that it remains secure and does not fall out. If it is difficult to remove, you can simply use a twisting motion to remove it. The plugs come in multiple colors. Both require that you remove the plastic lid prior to inserting into the catheter. Throw the plastic covering away as soon as you separate it from the plug. After removing the plug to drain the bladder, clean the end of the catheter and the plug with an alcohol wipe before reinserting. The additional port pictured here is for inflating and deflating the Foley balloon. Do not access this port unless you are inserting or removing the Foley catheter. While in place, urine will collect in the bladder and the catheter will not drain. If the catheter is being used to determine when a patient can successfully empty their bladder on their own, the patient should be given a voiding hat, which fits under the toilet seat. The patient should attempt to void normally through the urethra into the hat and measure the output. Measure the volume in milliliters. Then record the urine output in the left-hand column of the voiding diary in milliliters. Empty the urine into the toilet. The patient should then empty the residual urine from their bladder through the catheter. Ideally, the patient should be standing for this. The residual urine should be measured by emptying the urine through the catheter into the voiding hat or into a granulated cylinder. Squeeze the rubber part of the catheter to avoid urine draining and remove the plug. Then let the urine drain. The bladder may not effectively empty if the patient is sitting or laying down, which is why it's important to have patients stand to drain the post-void residual volume. Replace the plug when the bladder is fully drained after cleaning the end of the plug with soap and water or an alcohol wipe. Record the volume in milliliters onto the voiding diary in the right-hand column. This is called the post-void residual volume. Once the patient's post-void residual volumes are less than 100 milliliters, after each voiding session consistently for about 24 hours, the catheter can often be removed. Now we will review the removal of the catheter. In order to remove the suprapubic catheter, the insertion site will be cleaned with an alcohol swab. Some surgeons place a suture near or around the catheter to secure the catheter and reduce urine leakage around the catheter insertion site. The suture should be removed prior to removing the catheter. The catheter balloon will then be drained with an empty 10 milliliter syringe. Ensure the entire 10 milliliters of fluid is drained from the catheter balloon prior to removal. Once the balloon is drained, the catheter can be removed. The catheter removal is very quick and may cause some minor discomfort. An absorptive dressing should be placed over the insertion site as it heals, as it will take several days for the tract into the bladder to heal, and the site will drain urine until it is fully closed. The dressing will need to be changed more frequently when the catheter is first removed. Please continue to have a dressing in place until urine is no longer draining from the site. The insertion site should be cleaned with normal soap and water until it is healed. Monitor the site for signs of infection, to include spreading redness and hardness around the incision, warmth, increasing pain, or drainage of pus.